to State of the Heart, a new series from Community Care Network of Kansas. I am Denise Sisman, CEO of Community Care. Each month, State of the Heart will examine the compassion and dedication driving the mission to deliver equitable, whole person care to underserved Kansans. We will explore foundational beliefs, policies, and provider practices through the lenses of community, care, network, Kansas. Today, we shall discuss the theme of community. Joining me is Daniel Dawes, author of 150 Years of Obamacare, and more recently, The Political Determinants of Health. Daniel is a nationally recognized healthcare leader, attorney, policy expert, administrator, and author who has been at the forefront of some of our major federal healthcare policy negotiations. His work focuses on health reform and equity, behavioral health, social determinants, poverty, and systems transformation. And he is a professor of health law and policy, the director of the Satcher Health Leadership Institute, and executive director of health policy and associate lead for government relations at Morehouse School of Medicine. And he also presented at our annual conference, and we are so happy to have you back with us again today, Daniel. And I have a chance to say that your book is phenomenal. It is a good read. It really gave some practical applications of how to deal with the political determinants of health. And what struck me, as if I could talk just a little bit about myself, as a young public health professional in the 1980s and even into the 1990s, we were really focused on how to address health inequities downstream at the individual level. Now, we were still doing prevention, so we thought it was upstream, but it really is more downstream, focusing on the individual. And public health then, in my career, began to move a little bit more at what you call the midstream, which is at the community level. And in my case, it was passage and enforcement of the Clean Indoor Air Act. And eventually, as part of my career, we eventually saw the need to move even further upstream to address structures, processes, and outputs that result in health inequity that you talk about in your book. What I find really intriguing about your book, and what was somewhat new to me, is the opportunity, if not the responsibility, to move even further upstream to look at the political determinants of health. So we're really excited to be able to dig a little bit deeper into that. And I thought a great place to start would be to describe for our viewers the political determinants of health, your book, and tell us a little bit about why you felt the need to write the book.
Absolutely. Well, let me just say hello to you again, Denise, and thank you so much for this opportunity to have this conversation around the political determinants of health. And I'm so grateful that through your work, you have seen the need to address these pesky determinants in some cases, right?
Right.
So when we talk about political determinants of health, I think for me, one of the issues has long been, we've recognized in public health that there are multiple interacting determinants of health that impact our overall health. They impact our life expectancy, right? The quality of life that we're going to have on this earth. And if that's the case, what's been fueling these multiple determinants? What's been instigating these determinants of health, whether they are environmental or social? And there is one common theme that you find throughout these multiple determinants, and it's political determinants. Underlying every single one of these has been a policy decision, a political action or inaction that has led to the result that we see in our community. So if we're talking about social determinants, for instance, right, which we know is a very popular item for discussion in public health, and I think the research that many of our colleagues have done looking and examining these social determinants of health, these structural conditions in which we are born, in which we live and worship, and the role that they play in terms of their relative percentage among the other determinants. We know they play an outsized role. Well, if that is true, then it really does beg the question: how is it that these structural conditions in our communities came about to begin with? They didn't just magically appear. Someone further upstream had to have made a decision that allowed that to happen. So, as I was traveling around this great country of ours and went from city to city and town to town, whether urban or rural, there are certain things that I saw, and it just didn't make sense why things were the way they were. How did they come to be in the first place? As I traveled in major cities, and I know you have major cities in Kansas, right? Wichita and Kansas City and others. But as I traveled to these cities, one of the things that I noticed was that in many African American communities, I noticed that there were neighborhoods that were split by a highway. I noticed that there were other infrastructure that didn't make sense to me about why they were placed the way they were. Why would the neighborhood, build? Why would they build around this highway? Well, they didn't build around the highway. They were there first, and then there were decisions that were made to place that highway to run through. It's the same thing when I went to New York and I saw in Manhattan, in Harlem, that there were so many bus depots, and I couldn't figure out why were they located there? And as I dug deeper and realized that they had some of the highest asthma rates in the country, well, no wonder they were breathing in all this polluted air. But again, how did those bus depots get there? And as I asked the members of these communities across the nation about, to tell me about the history of their communities, to tell me about how that got to be, many of them couldn't tell me why. Many of them were children when it happened. They'd grown older, but they just didn't have the wherewithal to ask why, right?
Right.
And so I thought, well, this is really, really interesting to me that all of this has happened, but we don't quite, we either don't know or we don't remember. And so I wanted to create or write a book that would examine how a lot of these inequities, health inequities in particular, got concretized into our communities, into our structures, into our institutions, because it is so difficult sometimes to flesh them out. So that was really to move us further and have this uncomfortable discussion, right, about how these results occurred in the first place. And what's been interesting to me is whether you are Republican or Democrat, what we have seen is that, it doesn't matter. Racism has a very interesting way of rearing its ugly head in policy. And it doesn't matter the party, we have seen similar results across the aisle, right, when it comes to the creation of these policies. And so I wanted to highlight that and remind folks about this history, and then to think about how, the levers have been pulled and pushed to address these inequities, right? These political determinants of health inequities, and what has worked, what hasn't over time. And so that book was really my attempt to start a conversation that's long been overdue in this country, and to get us to start thinking more critically about these drivers of inequities.
And thank you for that. I have to say that you'll have us thinking about our policies in different ways. And I work closely with Patrick Lowry, who is our Director of Communications and Governmental Relations. And I know he and I are going to dig deep into our policy priorities and think about this in terms of looking at it through the health equity lens. So thank you for that.
Wonderful.
Give us a little bit of work to do here.
So I think, Denise, you all will be trailblazers in this movement then.
Well,
and I think the work that you do will serve as an incubator for the rest of us around the country. So I'm really looking forward to seeing what you all come up with.
Well, thank you. And we'll get you on speed dial. So in your presentation at the Community Care Annual Conference, you spoke about assuring that there is equity in all policy. We've heard health in all policy. This is equity in all policy. And what do we need to consider as we are looking at policies to think about to assure that there's equity in whatever policies we're proposing or fighting against or wanting to modify?
Oh, absolutely. Well, thank you for that question. And I think for many of us who are public health champions, we have long subscribed to that health in all policies approach. I do believe, though, that in order to get to that level, right, to really push that agenda of health in all policies, if we don't take an equity lens, there are many folks in our communities who will be left behind. So a health in all policies, yes, that is an audacious goal, but an even more audacious goal is to apply that equity lens to it. So when taking that equity in all policies approach, I believe that one of the key things to consider is our own limitations, to put more bluntly, our own biases. And I think equity requires a tailored approach for different populations to ensure that everyone has a fair opportunity to reach their optimal level of health. And in order to do that, I personally might not have the answers to what a given group will need. I would never be so presumptuous, just like you might not know specifically what a different group might need.
Mhm.
And there is power in knowing that it takes a collaborative effort to ensure that equity for all means representation and inclusion for all. So I would suggest that the folks who are closest to the pain be allowed to have a seat at the table to help craft these policies. I think for too long, many of these groups that we've been creating policies over time have been excluded even at that policy table. And I think our policies reflect that exclusion very much. So moving forward, I think it is imperative that we take that equity lens to our policies.
Those are words to live by, and we'll definitely keep that in mind. And our community health centers that we serve are very focused on their community, and they actually have more than half of their board members are patients from their health center.
Wonderful.
So yeah, it's a great way to start those dialogues about policies, and we'll be asking them to help us out with that. So thank you.
Excellent. You're welcome.
Yeah. One thing that struck me during your presentation at our conference was the need for us as a society to value the investment of change. And we're actually reimagining our organization as a change agent. We want to be an organization that is known for catalyzing change. Can you talk to us a little bit more about how we can enhance that value of change? How do we enhance ourselves or enhance or demonstrate the value of our organization as a change agent?
Oh my gosh, I love that question because, in this country, we have never been able to realize an equity focused policy unless we demonstrated the value of change. And so in order to do so, I think that we have to show, how substantive policy changes, these policy changes that we seek, will lead to beneficial disruption in the short term and long term. People don't like that word disruption, right?
Yeah.
And we become averse to change. And so, you have to show that that disruption will be beneficial both in the short term and the long term. Or result in a positive return on investment, both near term, midterm, and long term. So in policy, we have been mostly reactive, right? Not proactive, mostly reactive.
Yes.
And if we can show definitive short-term outcomes, then it makes it harder to overcome the apprehension that policymakers and commercial interests may have with a substantive policy change. I think if we do that, that will help the cause. If we are unable to show that link, then it makes it even more difficult. And the truth be told, we've never been able to realize a policy change that is equity focused unless we do so. So I think that's something to keep in the back of our minds in terms of how we align it, right, to those causes.
Right, right. And what I love about your answer is that legislators and other policymakers love those short-term outcomes. They want to see what they can do, particularly those that have a 2-year term or are just really interested to make sure that they're allocating the funding in the right way. So the short-term outcome is important. And then as I was listening to you, I was imagining how if you are inclusive of the communities that you are serving and that you want that will be impacted by the policy, that also will help to demonstrate the value because you'll more likely to be on the right road to the policies that will make those changes than if you are doing it based on your own intuition or data that you've seen and not including those important voices.
And Denise, I'm so glad you raised that, because I think it's also important that, in bringing these folks to the table to help craft the policy, that is really important, right? We've
Yes.
not done a good job there, but we also have to align that with those communities that have the power and the privilege as well.
Yes.
What's in it for them? How does what we are advocating for, impact those groups that have greater representation or more power? And we've seen this in Mississippi, right? Where there have been, a look at various policies, and the representatives from the communities that have the least privilege were the ones that were the less likely to get their policies passed in the Mississippi legislature. So it really begs that question about what else could they have done then? You brought in folks to the table, but you've been able to craft policies that would benefit, as many folks in that state. But why haven't they been able to really move that needle of health equity forward in policy? And it's because they were not successful then in showing the interconnection of what they were doing with the other more powerful groups. You have to make that link. You've got to make that argument to how what affects one will impact the other one. We are, again, all interconnected, and we need to do a better job making those arguments.
Yeah, absolutely. And I think the next question kind of dovetails with this. In your book, you suggest that when moral arguments aren't enough, advocates need to focus on economic or national security arguments. And I know here in Kansas, the economy is incredibly important, and we also have a strong military presence, and we are very focused on security of our communities as well as our state. So those kinds of arguments would make sense to our legislature. But I'm wondering that, what happens when you are looking at even national security or state security and economic arguments, and there's disagreement about the underlying facts. And when the facts appear to be in dispute, how does that impact the way that we tackle racial inequity?
Yeah, that's another great question. I know, when we talk about the moral argument, you certainly can talk about the fact that people are dying and they're experiencing, poor health outcomes and, poor quality of life. And you can talk about that till your tongue is bleeding, and it doesn't make a difference. So I'm glad that at least, in the state of Kansas, there might be more, reception to economic and national security arguments. But when it does come to the fact about underlying facts, when there is an agreement on underlying facts, I believe you have to remain steadfast in your commitment to facts. To a certain extent, I think reframing the narrative from a moral one to an economic or national security one is a concession in and of itself. And typically, making that shift should sort of, level set, if you will, and help you avoid any dispute on the premise. But there comes a point where you have to either remain committed to the facts that are our resources, right? Or else you might go down a very slippery slope. And so, the way I would argue this is that, and the way I have done this, is if somebody is disputing the facts, I think you have to speak in their language. You have to, tie what you are trying to achieve to something that resonates with them, right? Whether it is a public safety argument that you raise, whether it's dealing with drug addiction, right? How do you tie what you're doing to something then that will resonate? What is a priority for that policymaker? How do you then bring up an issue if there are no agreement on the underlying facts? How can you tie and reframe it to something that will move them? Because then I think at that point, you can employ all the facts you want, it will never lead somewhere. And I think, again, we haven't done a good enough job, reframing things and aligning it to what those policymakers may see as a priority. We have to also move beyond admiring the problem, right? And, and do something about it. I think we need to show that there are tangible things that we can do, and that whatever we are proposing will show tangible results. So a lot of times, it's such an abstract thing for many policymakers. If you start talking numbers, you start talking facts, but what can we do that would be tangible so that they can, they can see it, they can feel it, they can touch it. It's real for them. And I think we need to do a better job creating those toolkits so that they can, can see it and lessen the disagreement that they may have on the facts. That's how I might approach it.
Yeah, interesting. Very interesting. And we'll talk a little bit about Medicaid expansion in a few minutes, but as I'm thinking about this for our next legislative session, I think that there are many ways that we can look at it with an economic lens. And I know that we have been trying to do that over the past several years, as well as to tie it to some of our most challenging problems in Kansas, which include the behavioral health, mental health, and substance use disorders. So food for thought there. Appreciate that.
Yeah, absolutely. And I would just say, Denise, that, when you look at every one of these policies, health policies in particular, that have been successful, every single one of those were successful because they learned really quickly that if you can show tangibly how what you are proposing will lead to greater employment opportunities, will reduce costs to the system, all of those variables are what resonated and led to the passage of that particular policy. So I do think that economic argument absolutely works. And from a national security standpoint,
Yes.
If you can tie the fact that, if we are keeping certain groups of folks downtrodden, when it comes to, being able to outcompete our global competitors or defending our nation from external threats, that's something that's also resonated with many of these policies over time, both that economic and that national security argument.
Yeah, very, very interesting. Thank you.
Sure.
In your book too, you also identify three major aspects of political determinants that they include voting, government, and policy. If we had to prioritize as an advocacy organization, which one should we tackle first as we try to tackle health equity? And can you tackle one without the other?
So in the book, I argue that, these are, things that happen simultaneously, right?
Yes.
And so I guess first off, I really wouldn't want to prioritize. I feel that they are equally vital to moving this needle forward. But if I absolutely had to go there, I certainly would go with voting, especially in the time that we're in just the election period. That is our strongest tool for effectuating change in government and policy. If you can vote out individuals who don't prioritize health equity and vote in leaders, right, who do care about this issue, it does make your job a lot easier. And then you can begin the process of reforming government and implementing actionable policies. So in the book, I talk about a lever that we have not utilized, and that's the lever of citizen-initiated ballot initiatives, right? What I call ballot augmentation.
Yeah.
And when you look back at the history of our country, ballot initiatives actually, in terms of health policies, have had about a 25% success rate in this country. And yet we haven't leveraged them as public health and health equity leaders. And so I think that is one lever that we can use to bypass legislators who may not be amenable to advancing a more equitable and inclusive policy. Something to think about as we're moving forward. So yes, I do think voting is probably the biggest priority.
Yeah.
And I think we need to do a better job showing our communities that voting can mean the difference between life and death for ourselves, for our families, for our communities, because they do dictate, how long, right? Once the resources are aligned, how long we can live on this earth.
Mhm.
and then the quality of life that we're going to have on this earth. And
Right.
so folks need to be able to connect those dots better for their communities. I think, too many folks don't connect those dots. They don't realize, wait, oh my gosh, this has, you know, life implications and health implications.
Mhm. For generations to come, too.
Absolutely.
Yeah.
That's right.
So I'm a fairly new grandmother, so a lot of what I think about is what's going to happen when my grandson gets older and how can
That's
I make
right.
this a better world? So absolutely.
Exactly.
Yeah.
Yep.
Um, so do you believe it's even possible to remove political forces from health policy decisions? And if so, are there any strategies that you would suggest that we try?
Uh, well, I think the way I've always looked at this is public health. Every aspect of healthcare, of public health, has a political underpinning to it, right? So it is difficult, I think, to remove political force from health policy decisions. I don't think I've ever seen any evidence in our nation's history where it's been possible to remove that political force from that health policy decision. So, if you're looking for the opposite answer, I won't be able to give that today.
Yeah.
Uh, Unfortunately, I think that's a reality of the system,
Mhm.
that we live in, and so unless we were to totally revamp that system, I don't see that happening.
Yeah.
But I still think that doesn't mean that I don't still have strategies, right, that we could go. And so, as you referenced before, I think that finding a more palatable starting point is one of the best approaches. So, for example, shifting the health equity argument from a moral one to a national security or economic argument is one. In many instances, if you can frame your advocacy as economic in nature, that will alleviate the partisan concerns that tend to stymie progress, right? And at the end of the day, it's the partisan force that I think we need to remove from health policy decisions. So political force, are tools for good when we leverage them properly.
Mhm.
But it's that partisanship that I would love to see removed from health policy.
Absolutely. We are all in this together and
That's right.
be great to come up with solutions together. So
Absolutely.
that's, I think, all of our collective goals for those of us that are trying to tackle health equity.
That's
Um,
right.
and so I guess related to that, many political leaders are still trying to understand and wrap their arms around social determinants of health and the effect on health that, as well as all other parts of somebody's life. Now we're talking about political determinants of health. Is that something we need to explain to them, or is it enough for us to know as advocacy organizations that we need to address these and deal with these without trying to explain that to a policymaker that that's part of the equation?
Well, I really appreciate that question as well, because I think what we saw, even around the social determinants of health, is that there were a number of policymakers who, did not, they were still on the fence for the longest while about exactly is that, what is that agenda that you're pushing? What are the social determinants of health? And they felt uneasy about it, right? Now, of course, when you talk about social determinants of health, that's become more palatable over time, right? Across the aisle. I think, whether you're Democrat, Independent, Republican, I've seen, all groups navigate towards the social determinants of health and have started to embrace that notion. However, what I still think is an issue is the political determinants of health. And I've had the opportunity to speak with a number of policymakers from across the aisle who said to me, "Wow, I didn't realize any of this history." And I'm even talking about folks who have been champions for health equity as policymakers, right? Who didn't understand and didn't make that connection. They did not connect the social determinants of health to their political roots. And so I do think it's an and, not an or. Yes, we do need to educate the advocates. We need to educate these community leaders about the political determinants. And we also need to educate these decision makers in power about how these levers have been pushed and pulled to effect the changes that we've seen, right, over time, or to maintain the status quo over time. And so they will argue that I didn't know. And so I do think it's incumbent on us to make sure that we do, we are diligent in our educational efforts around these political determinants of health, that they understand how these communities, these inequities that are experienced by vulnerable communities came to be to begin with, because then they won't be able to say, I didn't know. I've been ignorant about these things. No, it is really important that at the grass tops and at the grassroots, everyone is informed about these political determinants of health. Because it doesn't, I don't think it helps just at the grassroots level to have these folks knowledgeable about the political determinants of health and they doing what they can, unless we can also win over folks at that grass tops level to help us move swiftly on addressing these political determinants of health.
That makes sense. Absolutely. So let's come to our home state. Have you come across any Kansas examples in your research of either positive or negative policy that could impact health equity?
Oh yeah, absolutely. So I think, in my opinion, one of the more negative policy decisions that continues to hamper Kansas is the decision not to expand Medicaid. All of the data shows that expanding Medicaid would be a net positive for your state. And so the resistance to expansion is really disappointing. And I'm sure for many of the residents of your state, that is true. However, because I'd much rather look at the positives, I will say that Kansas has made strides in addressing mental health parity. A couple years back, the Kennedy Satcher Center for Mental Health Equity, which is a part of my institute, the Satcher Health Leadership Institute, issued a report card for all 50 states. We looked at each state's respective response to the Federal Mental Health Parity and Addiction Equity Act, and looking specifically at state statutes designed to ensure equal access to mental health and addiction treatment. And what do you think we found with Kansas? Well, Kansas did not receive a failing grade, right? That's the good news.
Yeah.
Kansas did not receive a failing grade, which I think is commendable given the fact that 32 states did in fact receive a failing grade from us. So I would absolutely applaud Kansas, for the work that they've been doing around mental health parity and addiction equity.
Mental health is certainly a high priority for us, and I have the honor to be on a special legislative committee that's dealing with the modernization and reform of our mental health system and infrastructure. So it'll be good to share that little bit of news with them and know that we're starting from a good place.
Yes.
That's always right. A good thing.
Yes.
But let's go back to Medicaid expansion. This wouldn't be a complete interview without us talking about that, Daniel.
Sure, it is an important issue.
It sure is, and one we've been working on for many years, and we were so close this past legislative session, and then COVID-19 came and turned all of our worlds upside down. Yeah. But we know, and you had mentioned, Americans in all states, and we have red and blue, Democrat, Republican-led states, have supported Medicaid expansion. And the polls in all of the other states nationally, and also here in Kansas, continue to show that it is popular, that everyone wants Medicaid expansion.
Yeah.
So what do you think? Do you have any words of wisdom? What do you believe that we need to do to overcome the politics of healthcare in order to expand Medicaid in Kansas?
Well, I would never be presumptuous to assume that, I could tell you or share with you, what I think can help to overcome the politics of healthcare and Medicaid expansion, especially in Kansas. But I think we need to hit a critical mass. I think, with all that's going on, with the triple pandemic that we've encountered, right? Not only relative to COVID, but relative to the inequities, relative to loneliness that's been striking us, all of these mental and behavioral health issues that have been looming, if we can't leverage these crises, right, and reach a critical mass, then I hate to seem, like I'm all doom and gloom. I don't know what else would make that case. So there's a lot of discourse in the media about the disconnect between our leaders in Washington and what the average American wants. And I think nothing exemplifies this more than the Affordable Care Act, and more specifically, protections for pre-existing conditions. When the ACA negotiations were underway, or even during the most recent repeal and replace efforts, there has been, quite a bit of pushback on protections for pre-existing conditions. But one thing we know is that those protections are widely popular with the general public. We had to find that sweet spot, right, within the ACA to create this critical mass, to push back on those efforts to repeal and replace the ACA, to get folks to wake up and understand what was at stake. And so, to that end, I think getting rid of those protections now is going to be exceedingly difficult and exceedingly unpopular. And I know that many of those policymakers who've opposed the Affordable Care Act have recognized that. But I think the same has to be said for Medicaid expansion. What can we do? What arguments can we raise to get that groundswell, to create that sea change that is needed to really get that? I know you said you were so close to getting it over the finish line. And yes, there are a host of external groups that have played a role in preventing you from realizing that. But again, all politics is local. And I think we have to mobilize folks. We have become so complacent over time with our networks. And I think we've got to revitalize those networks. We've got to get folks around this issue and to create those tangible arguments that we talked about early on in our discussion about Medicaid expansion and why Kansas would be better for it. And then I think, we can leverage these other policy levers that we talked about early on too, if that hasn't been tried and tested. Have you all tried, the ballot augmentation that we spoke about earlier?
Unfortunately, that's not an option in Kansas.
It's not.
It is not. So we've had discussions, but our Constitution does not allow it. We know that states around us have had success with it. So.
Oh no!
That's
well,
not a path we can go down.
It's not a path. Okay, so we're really going to have to work diligently on helping to educate the masses, right, and getting that groundswell and that grassroots, advocacy activated. So,
right.
Yeah, I'm afraid I can't give more then. That's a difficult one for even me.
Yeah, I think though that some of what you said that resonates with me is that, or at least what I heard is that, Medicaid expansion is a solution to a lot of issues, challenges that we're facing. And
right.
It's not the only solution. It's not going to solve all problems. But as we're trying to deal with rural healthcare and the loss of, closings of hospitals, as we are looking at individuals who don't have access to mental health and substance use disorder services because they don't have insurance. As we're looking at just how do we create, healthy moms and healthy babies, and how do we also, create a world of children that are going to grow up to be strong Kansans. Medicaid expansion would be a significant help. So, if I think about it, it's like, how do you put all of those together and get folks who are behind each of those efforts? And, I love the idea of sort of a groundswell and where everybody's saying we can't not do this.
Right.
That just doesn't make sense.
Exactly.
So we'll see what we can do in 2021. I know that it's not, we'll definitely be working our hardest and having a lot of great discussions with our policymakers. And so I just want to close with maybe a little bit of a hot topic, but certainly something that is very timely. And that's during the first presidential debate, which was last night from when we were taping
Right.
this. We heard very different visions about the Affordable Care Act, and you have experience. You were part of the group that wrote it, and we know that it's going to be or it is being challenged at the Supreme Court level, and possibly even having a decision come shortly after the election. So, how would you frame up what might follow in terms of the political determinants of health? And how could our health centers prepare for a world that may require them to serve even more individuals who are lacking health insurance?
Yeah, that really is probably the biggest question you've posed to me now, because it's
Yes.
one that, and it's not because I haven't been thinking about it. I certainly have. I would say that we really are at a critical juncture right now in terms of healthcare access and health reform. And when I think about how long it's taken us to reach this point, to close that health gap that we have long experienced in this country, to come so close, right? And to see history repeating itself. I mean, this is an effort. It's not a 100-year effort. It's a 150-year effort for us to have gotten to this point of passing a comprehensive and inclusive health reform law, such as the Affordable Care Act. And so when I think about political determinants of health, when I think about what's next, and as I think about even those attempts judicially to undermine, to repeal the Affordable Care Act, those decisions by the Chief Justice were consistent with Supreme Court precedent relative to health policies, right? So the Supreme Court has never overturned a healthcare law in this country. And I wondered if the court would continue to follow precedent in that respect. If now, with a court that has swung farther to the right, is seated and hears this case and decides to overturn the law, that will have been unprecedented in the history of this country at the highest court, court in this land. So I am curious to see what they do there and how they decide that. Will they remain consistent like they have with the two other major decisions that they have made thus far, or will they allow themselves to be pushed in that political direction that opponents of this law have been trying to push them? I guess we'll have to wait and see in that respect. If they decide to go ahead and overturn the law, then I cringe to think what it will mean for us. So there are some pieces that I haven't lost complete hope over. So when you think about payment and delivery system reforms, such as value-based care, when you think about accountable care organizations, you talk about issues, programs to improve the quality of care, I think those will remain, because right after the ACA was passed, 3 years, actually 5 years later, the Medicare Access and Chip Reauthorization Act was passed. And what that did was to, not only reauthorize many of the ACA provisions and programs, but it actually expanded these delivery and payment system reforms. So I don't see those going away, even if the ACA were to be abolished. I think, it is the health insurance reforms that I'm waiting with bated breath to see what would happen. That's the piece that gives me the most sleep deprivation. If they decide, to go ahead and it does repeal and it interferes with those coverage provisions and those provisions that are, intended to increase access, then I cringe to think what that's going to mean for people in terms of access to care in this country, putting them again at the state that they were prior to the ACA being passed. I also think about those protections that were not included in MACRA, right? That would, drop with the overturning of the ACA. So these, these provisions that prevented folks or prohibited insurance companies and employers from discriminating against their employees with pre-existing conditions, from denying women, right? Parity in terms of the amount of money that they have to pay for their coverage in the individual insurance market. I cringe to think that those provisions that we had included that would prevent insurance companies from canceling, from rescinding coverage to women who've been the victims of domestic abuse or rape, having those protections in place, or Section 1557, that was the first time in US history that consumers actually had a personal right of action to protect themselves from discrimination in coverage and in healthcare access. So all of those would go away depending on how, of course, the decision is written to overturn the ACA. I'd be curious to see where those land. I do think that there were other provisions. There are 62 health equity provisions in the ACA, many of which, opponents of this law, Republicans in the House and Senate, fought tooth and nail to deny funding for. So many of those provisions were never funded and could not be implemented. So those will continue. I guess they would never see the light of day then, but there are a number of them that were funded and were implemented that would concern me. So those are some of the ways that I see this working out. I think there is general support for many of the delivery and payment system reforms. I think those will continue to be bolstered, and we need to expect and move towards that and make sure that we are doing what we can to provide the highest quality care, the highest value care to consumers, because I don't see those coming out. But I do see the health insurance reforms being a very touchy issue. Yeah. And then, we talked about Medicaid expansion a lot. If that's the case, I would be curious to see then what would happen to existing Medicaid programs that were authorized under the ACA, and what that would mean then for coverage. There were provisions, you heard me talk about the 62 provisions that were targeting the elevation of equity. A number of those were to create offices of minority health at key agencies at the US Department of Health and Human Services. What will happen to those offices of minority health and health equity? What will happen to the National Institute of Minority Health and Health Disparities that has long been researching health disparities among vulnerable populations, not just racial and ethnic disparities, but rural disparities, disparities among people with disabilities and the like, right? What will happen to that critical institute? So there are a lot of moving parts to this that I'm real curious to see what's going to happen there. So there is some hope with the delivery payment system reforms, and I think from CMMI, but then even if that's the case, what happens to CMMI then that was authorized? This is the Centers for Medicare and Medicaid Innovation, right? The Innovation Center that has been doling out billions of dollars to create models to actually improve, quality and value of care. What will happen to that institute in terms of providing grant funding to community health centers, right? That have been engaged in that work and have been trying to catch up and get up to speed in this movement. So a lot of probably more questions I'm raising than answers, and I apologize for that. But it is a very complex issue, and it's one that we're all going to have to think about once a decision is made at the Supreme Court level, and then once the election has determined what our new government is going to look like.
Right.
That will determine what levers we will have, what opportunities we will have.
Definitely, it's hard to imagine.
Yeah.
So I know that we'll have to all pull together and see what we can do, but I think there's going to be a lot of devastating consequences if we no longer have the Affordable Care Act.
Absolutely. Yep.
Well, Daniel, thank you so much. And I just want to say, or to ask you, is there anything else that you want to share to our viewers that maybe we haven't touched upon yet today?
I think I'll close with my closing during your conference. And it's this notion that, when we look back at the history of this country, we started with a discussion on the political determinants of health. We know that it is these political determinants that have been the main instigator for what we have experienced in our society relative to the lack of healthcare access, relative to the fragmentation of health services that we have seen and experienced in our communities. And so for me, health equity begins and it ends with the political determinants of health. It is these political determinants that have created and perpetuated over time, and now we see being exacerbated during these crises. So it is something that we have to seriously consider and not be afraid to tackle. I think, when we think about what Dr. Satcher has been saying for a number of years as our former Surgeon General, that we need leaders who care enough. And I know that, when we talk about your organization, we talk about the leaders in these community health centers across Kansas. These are leaders who care enough, or else they wouldn't be in this work to begin with, right? Mm-hmm. But we also need to know enough. And I would urge your members to continue to read up on these political determinants, to become familiar with their own communities, right, relative to the histories and the political drivers that have compounded these issues over time, to understand them, and then to be, persistent in their advocacy. I know it can be discouraging when you look back at the history and realize that, there is a dearth of equity-focused policies, especially in health policies, right? And it is discouraging when you think about it. Mm-hmm. But we can't afford to lose hope or faith as we are moving forward, because we are so much closer, right, than we've ever been to moving this needle of health equity forward. And I do believe that despite what we are encountering right now, that we still have the knowledge, we have the leadership that we need. And because we know the history, right, that every single time that political pendulum swung back and it undid a lot of the things that were gained policy-wise, the advocates lost the political will to continue pressing on. And I just hope that we do not repeat history, that we will continue to have that political will to keep pressing the notion, that we will work with our policymakers across the aisle to get it done, to inform them, to educate them about these issues, because we can no longer afford to ignore this. Where our country is moving right now, change is inevitable, whether we like it or not. We are moving towards a more diverse society, and that's going to mean that we care about each one. We value each member of our community. We can no longer continue to ignore that like we've done in the past. If we do, it's to our own detriment. Mm-hmm. So thank you again for the privilege of your time, Denise, and thank you so much for the opportunity to have this conversation and to flesh out some of these issues.
Health is about so much more than treating sickness or disease. It's about being healthy and staying healthy. Healthcare itself is changing to meet the needs of the patients. And through partners such as Dawes, we are committed to advancing that future and providing wellness for all. A healthy Kansas means all of us together. Individually and collectively, we are all worth it. Thank you, Daniel, for your time and insight. I am Denise Sisman. Join me next month for another State of the Heart.